Well, hello and welcome to all of our viewers around the world. I'm Fiona Lang-Sharp, IBCLC Director of Communications and MC here at Gold Learning. I just love sitting down with these amazing folks who are going to be speaking at our conference. Jessica Diggs, I am so excited to have you here at Gold Midwifery this year. I mean, it is really a pleasure. You're talking about such an important topic. We've been, chatting about it all today, and I'm going to ask you some questions about how this all began. But let's tell our friends where they can find it. They can go over to goldmidwifery.com right now and log in and get all the details on this presentation, Enhancing Sexual Health During Pregnancy and Postpartum. Welcome, Jessica. It's great to have you here today.
Thank you for having me. I'm so excited.
That is awesome. So tell me, we were talking about how this is such an important topic, why we're not talking about it more. Like, I feel like I have this conversation with a lot of my colleagues and friends, but yet here we are, Jessica, still saying that, the topic itself just seems to still hold us a little bit hostage in the sense that we don't get the opportunity to be expressive and really embrace this. Where does this come from? Is this from the providers, or is it from the family? So where are we at in sort of talking about this right now in general?
I think it's a little bit of both. I think some providers feel a bit underqualified to really explore and hold space for people's sexual experience because it's not necessarily always a clinical solve. Right. And sometimes it's just holding emotional space and giving suggestions of talking to partner and family dynamics instead of an estrogen cream, and sometimes people feel a little underqualified for that.
Yeah.
And then as on the patient side, many people are a little embarrassed to talk about their sexual experiences, not just with their provider, but with friends too. So I think culturally it's just a taboo topic for all involved, and it has led to us having less conversations and less information about it.
Yeah, I feel like information, like you're absolutely right about that. I feel like information is really shy on it. It tends to be that maybe if you've got a good trust relationship with a provider, the conversations can come up. But yeah, it seems like when you're in trouble, you might get more people asking, about what to do. But really, I mean, midwifery care is a model of care that is about preventative, things as well, right? So yeah, is very interesting. I love all the things that you're going to be talking about, including, what contributes to sexual desire and sexual pleasure. Because these are things, again, that are just not spoken about enough. And I think this could lead to some really healthy sort of conversations. But tell me first a little bit about yourself, because I always curious about, so how did this all begin? I mean, tell me, how did you get into this? Was it by demand, or tell me?
It started when I started birth work at 19. So I was actively trying not to get pregnant. No one in my circle was trying to get pregnant. And it started from a place of curiosity about our bodies and realizing that none of my friends knew anything about their bodies, from putting in a tampon to navigating their first sexual experiences to some of them giving birth. And that is what kind of like the common thread was, we don't know enough about our bodies. And why is that? And that starts from sexual health all the way to childbirth. And that kind of sparked my interest in being a midwife and a person who provides that information. So when I moved through pregnancy with a bunch of people for the last 12, 13 years, I realized that sexual well-being is still the lacking area of information. Now we're talking about birth plans, we're talking about doulas, we're talking about breastfeeding, we're talking about a lot of other things that often were not well supported over the years, but sexual well-being is still the one thing we're not talking about for parents and in pregnancy in particular. And I often get a lot of questions as a gyne on the gyne side of midwifery care that should have been answered already. Like, people are 35 and they're asking me things, it's not their fault, but they're asking me things that they should have known about their bodies already. And so for me, it's the continuing thread that we just don't know enough about our bodies, and it's because no one wants to talk about it, or we've lived through experiences for so long and not realizing that we didn't have to.
Yeah, that's the other point, right? Too, that we've somewhat normalized not talking about it and thinking that they were normal, but not questioning. I guess that's, not being curious.
Mm-hmm.
And so being curious, I love that line, stay curious your entire life, otherwise, it may never happen. But in this sense, what I find that is so important is this just should be a normal part, particularly when we talk about birthing and pregnancy and postpartum. The whole spectrum of perinatal health should just include your objectives, quite frankly.
Yes. Yeah,
It just should.
I agree. I mean, I think I will talk more in depth about this, but I think it's like we only want to talk about sex and to procreate. When we know that people are having a lot of sex to procreate, or even if they needed some reproductive health technology, they still did a lot of trying before they made that choice. So you know that sex is happening, yet once they're pregnant, that's it. We never talk about it again.
Yeah.
And I am like, we are modifying everything from exercise for pregnant people to diet to certain medications they can and shouldn't put in their body. But we don't think that sex is one of those things that we might need to actually educate them about how they might need to modify or add something or how it might change because something is happening that's new to their body.
Right.
Yeah. And normal as I do an intake about what exercises, how Pilates might change, it should be as normal as me saying sex is going to change throughout this pregnancy. Here's how that's going to happen.
Yeah, absolutely. And I think there's always been this sort of essence of, I think predominantly women have carried a lot of shame into the postpartum period when they haven't felt well, don't know what to do, don't know what's happening with their bodies. And so then they're inundated as well as the pressure of being a new parent, right? It's a lot, Jessica. It's like even now I think about it and I experienced it, but it is a lot when you don't know exactly what's happening to your body. Do you feel now, I mean, given your position and talking about this subject and having all of this knowledge, do you feel like there is more fluidity for you in terms of just it being a normal, like, do you just include it as a normal part of your teachings or conversations with your clients? How do you incorporate it?
Good question. In pregnancy, I usually incorporate it in just a day in check-ins. I make it my business kind of to do a check-in mid-pregnancy more so. And that just more so have to build a little rapport with the patient first for them to answer honestly. And some people bring it up before I can get to it, but most of the time I'm asking the question. Postpartum, I always end our 6 to 8 week postpartum checkup with a conversation around resuming sex if they haven't already. And I normalize that. They don't usually ask questions. Every now and then people are like, they've heard it's painful, they're scared, or are really excited. And I just go straight into here are some things to consider. And I make sure partners are aware and they can hear me. And I talk about consent, tips, practical things from lube to how hormones will affect it and how stressors and just new life will affect it. And I make fun jokes about new parent sex and what that looks like. And spontaneity is not your strong suit right now. So scheduling may be a thing. And just normalize the conversation and then open it up for them to ask the specific questions.
Yeah. Well, I love that, Jessica. You are such a gift in this area, really, because I think you're going to help, not just your patients, but all the providers that you're going to be speaking to and helping them, make this a normal part of their, curriculum and a normal part of their visits with their clients. And I can't wait for you to just dive in a little bit deeper. So thank you so much, my friend, for being here today.
Thank you.
We'll look forward to seeing Jessica at our event at Gold Midwifery online, and I can't wait to see you. You can head over to the website to goldmidwifery.com right now. Check out all the details for this event. Jessica's actually going to be here. She's going to be one of our speakers who's going to be live on the day. It will be recorded for all of you as well, so if you can't make it, but I will tell you that it's going to be a great conversation. We're going to have a live Q&A with Jessica as well, which will just enhance your learning. I'll look forward to seeing you all online. Thank you again to Jessica Dix for being with us here today, and we'll talk to you all soon. Bye-bye for now, everyone.